Good afternoon and welcome to this press conference. We have Minister Lawrence Wong joining us via Zoom as he has just returned from a G20 meeting. At the last press conference, we announced plans to further resume economic and social activities as we journey towards an endemic situation. We aim to do so progressively and safely in line with the progress of our vaccination program. However, in recent days, we have seen a new and growing cluster arising from a number of KTV lounges. To date, the cluster has a total of about 120 cases. DMS will provide the greater details of the cluster later. Some of these cases had tested positive when we identified them, which means that they may have already infected others before they were isolated. Therefore, we expect the number of cases to rise in the coming days. Furthermore, some of the close contacts may be within the incubation period and tested negative initially. They may turn positive in time to come, adding to the case count. We will carry out contact tracing, community testing, as well as ring fencing for this cluster. This is a major setback in our journey to recovery, and I understand many Singaporeans will be disappointed, and so are we. We must respond to this emerging cluster quickly, especially to protect those who have not yet been vaccinated completely. While our vaccination program has made steady progress, the coverage remains inadequate, particularly among our seniors aged 70 and above. We will need to double down our efforts to vaccinate our seniors to protect them against severe outcomes and death should they be infected. We will need to make adjustments to our COVID-19 measures, but instead of rolling back these measures for everyone, like what we used to do during circuit breaker as well as the heightened alert, we will take a more targeted approach to protect those who are not yet vaccinated. From next Monday onwards, the number of people allowed in higher risk settings such as dining in and high-intensity exercise classes will be reduced to 2 packs for those who have not yet completed their vaccination. However, we will introduce a differentiated approach for those fully vaccinated. Individuals dining in together at F&B establishments can go up to a group of 5 persons if all of them have fully completed their vaccination. This targeted approach will better protect those who are yet to be vaccinated while allowing those who have been fully vaccinated to continue with the current measures. We will push ahead with vaccination because the higher our vaccination rate, the less we will need to make big adjustments. I want to encourage those who have not yet been vaccinated to come forward. Please also reach out to your elderly parents and grandparents at home and bring them for vaccination if they have not already done so. As this and previous clusters have shown, many household contacts have been infected without leaving their homes or participating in high-risk activities. Vaccination is therefore the only way to keep our loved ones safe. Let me also thank Singaporeans who have played their part in our battle against COVID-19. Your support will allow us to continue with the progressive reopening of our economy and our borders as we move towards endemic COVID. As I said earlier, the key is vaccination. The higher our vaccination rates are, especially for the elderly, the more we will be able to reopen. I now invite Minister Ong Ye Kung to say a few words.
Thank you. Let me start with some update on the KTV cluster and our follow-up action to contain the spread of this cluster. So as of 16 July, there are 120 cases linked to this cluster. And MOH is doing what we can to contain the spread. There are 3 main measures now we are undertaking. First is quarantine. When the cluster broke out, we are able to identify the staff working in those joints. And there is safe entry, and there is TT, trace together data, which we did use to contact trace some of the patrons. So altogether, there are 2,480 of these individuals, and they are all placed under quarantine. And during quarantine, they will be tested multiple times, entry, during, and exit. And some of them have turned out to be positive already. That is the first ring. The second ring is the other staff and patrons, because our safe entry and trace together data is not likely to be comprehensive for these joints. So what we have done over the past few days is to encourage patrons especially who have visited these joints or come into contact with the social hostesses in any setting to please come forward and get themselves tested. And there have been many who did come forward and has been coming forward to get themselves tested. So our call started 3 days ago on the 13th of July. So that day, 160 were tested, 17 were positive. So we are turning in a positive rate of 10%, which is quite high. And then 14th of July, it increased to 501 came forward to be tested, and 8 positive. So the percentage of positivity becomes lower. And yesterday, 15th of July, 1,003 came forward to be tested, and we had 0 positive. So I think what we see is that people who come forward, they are worried, they have visited, or they have been to the malls where these places are, and you can see the numbers, the C+ conversion decaying. So I think this is the group where I think the risk is contained. The worry now is who else have they come into contact with before they get themselves tested, and are they infected? And this is the bigger worry, which is the secondary infection. So all in, 1,660 individuals have come forward to be tested, either at our regional screening centers or our PHPC clinics, and 25 are tested positive so far. But those not positive and tested negative, we are not out of the woods yet because there is an incubation period. So if you are not quarantined, that means you didn't come into close contact with the confirmed cases. Notwithstanding that you are tested negative, continue to monitor your health and minimize interactions with your loved ones and with other people. Yeah. That's ring 2. And then there is actually there are 4 rings. This is a ring 2. There's a third ring, which is other members of public, which we issued health risk warning. This ring refers to about 2,000 members of the public who has come into contact with the confirmed cases so far, and they are picked up by our trace together. So I want to clarify, in case they are worried or their families are worried, is that these individuals, we are not saying they went to the KTV lounges, but you have come into contact with the confirmed cases, could have been anywhere, and picked up by our data. So they will receive, or they have already received, an SMS called health risk warning. This health risk warning is quite a serious matter. It contains a legal obligation where they have to get themselves tested at designated testing centers, and then you are legally required to self-isolate until your test results come out and is negative. And even if you are tested negative, we will issue them self-test ART, antigen rapid test kits, so that they can monitor their own health for the next 14 days. Somewhere towards the end of the 14 days, they are again legally required to go through another PCR test to make sure that you are not incubating and you are out of the woods. So that's the third ring. The final ring is called health risk alert. Here there are several thousand people, maybe more than 10,000 in fact. And this group issued this alert because some of the joints are located in malls or premises frequented by other members of the public. So again, this is not a group that have gone to the joints, neither have they come into very close contact with the confirmed cases, but they've been to the same places as where the joints are located. And they have no legal obligation to get tested, but they will be advised strongly to monitor their health, minimize interactions, and then self-test is very much encouraged for this group. The challenge of this cluster, unlike clusters in a mall or in, say, Bukit Merah, where we know who the tenants are, who live in which blocks, and we can mount a geographical testing exercise and test everybody within that geography. The problem with this cluster is that we don't have full information of who are the customers, where they have been to, and where they are now. It's hard to gather them together and to mount a special ops. But nevertheless, as you can see, the 4 rings, we are doing, MOH is doing whatever we can to aggressively trace and test them. Notwithstanding that, we should expect to see many more cases emerging in the coming days. So let me take a pause here and hand the floor to DMS to talk about the condition of the infected persons before I come back.
Thank you very much, Minister. As of the 16th of July, today, MOH will be reporting 120 cases associated with this cluster that has involved social hostesses, staff, patrons of KTV clubs and outlets, which we had first announced on the 12th of July, 2021. The first case that we detected was case 64693 within this cluster. We have previously reported that she was a Vietnamese short-term visitor pass holder, and she had attended a SASH PHPC clinic on the 11th of July after developing fever and acute respiratory infection symptoms on the 10th of July. She was isolated while awaiting her test results and continues to be in isolation after a positive COVID-19 test result was released. This index case is only the first case to be detected in this cluster. She is not necessarily the first case to have been infected and then to have contributed towards the entire cluster arising. She has been in Singapore for a while, and it's extremely likely that the seeding of the cluster arose as a result of an initial community spread, although where that came from and the mode of transmission is still as yet unknown. Our initial contact tracing investigations focused on close contacts of this index case, and that led us to detect a further other infected cases in the same household, as well as a boyfriend. And so 4 cases were reported on that first day, with all cases being quickly brought into isolation and with further contact tracing then resulting. We've since announced a further 8 cases on the 13th of July. That number increased by a further 42 cases on the 14th of July. Yesterday we announced 34 cases, and today an additional 32 cases will be announced. We have not finalized all the details for reporting, and further information will come out in the press release later this evening. The increase in numbers over the last 4 days is due to testing that was performed in several settings. 37 of the cases were detected because the cases were symptomatic and had attended SASH clinics, where COVID-19 tests had been performed and had detected the infection. 30 of the cases were detected through community testing operations, which Minister Ong had mentioned.
Sorry, DMS. There was a technical error just now, so some of them couldn't hear you. We need you to actually repeat again.
From the beginning?
Yeah. From the beginning.
Right.
Sorry.
I'll start all over again. Thank you very much, Minister. As of the 16th of July, Ministry of Health has reported 100 cases, 120 cases associated with this cluster, involving social hostesses, staff and patrons of multiple KTV clubs and outlets. We had first announced this cluster on the 12th of July, 2021. The first case we announced was case 64693, and this was the first case detected in the cluster. She was a Vietnamese short-term visitor pass holder who attended a SASH PHPC clinic on the 11th of July after developing fever and acute respiratory infection symptoms on the 10th of July. She was isolated while awaiting her test results, and she continues to be in isolation after her positive COVID-19 test result was released. This index case is only the first case to be detected by our clinics and to be treated for COVID-19 in this cluster. She is not necessarily the infected person who had brought that infection into this particular setting. And given that she has been in Singapore for a period of time, it is highly likely that this cluster was seeded through community spread, and the mode of specific transmission is still something that we haven't fully delineated. Our initial contact tracing investigations focus on her close contacts, and this led us to detect further infected cases in her same household, as well as her boyfriend. And therefore, 4 cases were reported on that first day, with all 4 cases quickly brought into isolation and with further testing and contact tracing performed. We've since announced a further 8 cases on the 13th of July. The number increased by a further 42 cases the following day. Yesterday, we announced a further 34 cases. And today, we are announcing 32 cases of COVID-19 infection. And that makes a total of 120 cases in this cluster as of today. We haven't finalized all the details, particularly of the last 32 cases that we're announcing today. And further information about those will come out in this evening's press release. My subsequent comments relate to the first 88 cases that we had reported up to yesterday. The increase in numbers of cases that we have picked up over the last few days is due to testing that was performed in several settings. Of the first 88 cases, 37 of them were detected because the cases were symptomatic and had attended SASH clinics where COVID-19 tests were performed and where the infection was detected. 30 of the cases were detected through community testing that Minister Ong had mentioned. These were specially conducted, as you know, for all who had visited these clubs and outlets and had close contact with these hostesses. The remaining 21 cases were detected when the cases were under quarantine during their entry into the quarantine facility. Our epidemiological investigations have identified that most of the cases in this cluster had visited multiple KTV clubs and outlets. And this was either multiple visits to several KTV outlets on the same day or multiple days during the period of concern. Some of the individuals who visited multiple KTV outlets, particularly on the same day, were visitor pass holders, and we cannot exclude the possibility that many of them, as mentioned before, were social hostesses. They come from a variety of nationalities that include Vietnam, Thailand, Laos, the Philippines, and others have worked as staff within these KTV establishments in a variety of roles. A second group of cases arose mainly in Singapore residents who were patrons and frequented these KTV outlets on a very regular basis. And it's likely that there's been considerable mask-off, close contact interactions which has taken place within these premises, which has allowed infection then to spread. And finally, we have detected infections among some household members, which suggests that some household transmission has already taken place. Of the 88 cases, 20 were asymptomatic and remain well in isolation. And the remaining 68 cases in that first 88 numbers had mild symptoms ranging from fever, cough, running nose, sore throat, some loss of smell and taste, and generalized tiredness with body aches. And at this time, the cases continue to have mild symptoms. None of them require oxygen supplementation or ICU care. The majority of these cases are young, which may have accounted for the fact that they were either asymptomatic or have mild infection. The age range of cases of the Singaporeans ranges from 19 years to 60 years old. And they are frequent patrons of these KTV clubs. However, as many of the more severe symptoms for COVID-19 infection only manifest in the second week of infection, we will need to continue to keep a close watch on all of them while they remain in isolation. Many of these cases are cared for in community care facilities where we have medical personnel, which includes doctors and nurses, to monitor their progress. And we admit those with a higher risk of severe infection into our acute hospitals where they can be monitored more carefully and can receive further care if their condition worsens. And this has been our strategy over the past 1.5 years to ensure that our hospital capacity is reserved for those who need it most. The present volume of cases that we have in our hospitals is manageable, and we have not exceeded our capacity in the hospitals or in the community care facilities. However, we remain on our guard for possible secondary transmission that can take place within this cluster through those who have patronized these clubs or had close contact with infected cases. And there is a risk, a possibility, that spread may occur to more vulnerable segments of our society, particularly the elderly who are as yet not vaccinated. And if this happens in a very big way, we may see more cases not only arising in the community as a result of infection spread from the cluster, but also lead to more admissions, and this may place our hospitals then under pressure. And this is something that we in MOH are watching very closely. Of the 88 cases, 82 of the cases were either unvaccinated or partially vaccinated. So in other words, they have not yet received immune protection from vaccination. And only 6 of the cases had been fully vaccinated. I'll hand the time back to Minister Ong to continue explaining about our response to this cluster.
Thank you, DMS. What DMS mentioned just now about hospital capacity, that's a key consideration when we decide on our safe management measures posture, which Minister Gan mentioned. We are taking a calibrated approach. We are not rewinding in a big way. But what we really need to watch and what will decide our posture will be our ICU capacity. Today, COVID-related ICU occupant is 1. We have 1 person in ICU, elderly. Our ICU capacity that is available for COVID-19 patients is about 1,000 beds. So this is what we have to watch closely. At any point in time, if we see that the capacity is under pressure, we will need to tighten up, hammer the transmission, go back to phase 2 heightened alert, for example, in order to preserve the capacity and preserve the proper functioning of our hospital. It's not unthinkable. In other countries, you notice the cases and ICU occupancy doubles every week. So if next few days, if more people fall sick, and ICU say is 25 people, in 1 week it will be 50, 1 more week 100, 1 more week 200, 1 more week about 500, 5th week 1,000, system collapse. 5 weeks is what it takes. We cannot wait 5 weeks. By 3rd week, if we see the number go up, action has to be taken quickly and rewind us back to at least phase 2 heightened alert. So what to watch out for in the coming days if we want to have a sense of our safe distancing or safe management posture. Infection numbers, everybody watch. Chances are next few days it will go up. But I suggest this, at this stage of the pandemic, with vaccination going on, it might not be the most important number. Because if the infected people, as DMS said, are young, they are vaccinated, their symptoms are likely to be mild, or they may not have symptoms at all, and they will not place a lot of pressure on the healthcare system. So instead, let's watch out on the number hospitalized with severe illness, needing oxygen or in ICU. That is the key number to watch in the next few days. If the numbers start to rise in a steep way, and that is bad news, it means we may have to consider significantly roll back the safe management measures. As to what will cause ICU numbers to go up and people to fall very sick, I think depends on 2 factors based on our experience. One is your age, the age of those infected, and second, are they vaccinated? So the problem we have today is that we have 140,000 unvaccinated seniors above 70, and so they are the most vulnerable. It is quite unlike, say, last year when we had a lot of cases in the foreign worker dorm, we could shield the dorm away from our community. And the dorm workers, they are young, they didn't put pressure on our healthcare system very much. And we could shield them away from our seniors, and seniors stayed healthy. ICU beds was not overflowing, and we could contain the situation. But today the worry is we don't know who are the patrons. We try to identify as many of them as possible. If they visited KTV lounge, if they go home, interacted with parents, grandparents, and the parents, grandparents are not vaccinated, they can be in grave danger. So that is what we most worry about. There are two ways we protect them, this group. One is general population vaccination, and two is getting themselves vaccinated. If the general population is well vaccinated, then it's harder for the virus to reach them because there is protection against infection by if you are vaccinated. So fortunately, our population is now much better vaccinated than weeks before, and it will help protect those who are not vaccinated. So let me give an update here. As of 15 July, total doses is now more than 6.5 million under our national vaccination program. Those with at least one dose is about 4 million, so we have reached about 73% of our population. Those with 2 doses, about 2.5 million, that is about 45% of our population. We now report these figures every day in our press release. And on average, we are vaccinating more than 66,000 individuals per day. And if we just look at our current bookings in our system, sometime next week, we would have 50% of our population receive 2 doses. So this is ahead of the schedule that I talked about in the last press conference. So by sometime next week, 50%. And we are well on track by National Day to have 2/3, or at least 2/3 of our population having received 2 doses of the vaccines. And we are getting very encouraging sign-ups, especially over the past couple of weeks, across all age group, percentage vaccinated or already secure a booking is 80% or beyond, except the group that need it the most. Those are 70 and above. Only 71% have either been vaccinated or have booked. So this 29% of this senior group, or 140,000 of them, needs to be vaccinated. So that is what we are going to focus on in the coming weeks. We are doing several things at the same time. First, as reported in the media, 2 days ago, we sent out a letter, or DMS sent out a letter to all our GPs and all our primary care providers to urge them, call up all your clients who are above 70. Ask them if they have been vaccinated. If not, quickly get vaccinated. Our volunteers from Agency for Integrated Care, the Silver Generation Office, and the People's Association, they continue to reach out to the seniors, knocking on our doors, visiting them at home, addressing their concerns, sharing with them the benefits of vaccination. And when the senior gets convinced, the volunteers also help make arrangements to escort them, if they have mobility issues, to the vaccination centers. And so far, 100 of such escorts have taken place. As of end of June, the Senior Silver Generation Office have reached out to over 650,000 seniors nationwide. We are also sending out our mobile vaccination units to reach out to as many seniors as we can, deploying them in the community to be close to them. So there are 10 teams altogether, rotating around towns with a high number of seniors unvaccinated. So they'll be around towns like Kallang, Ang Mo Kio, Bukit Merah, Woodlands, Bedok, Aokang, Sengkang, Yishun, Tampines. So in the coming weeks, we are going all out to try to reach out to this group of seniors in order to protect them. So I hope out there, anyone who know any seniors unvaccinated, please help us persuade them. The benefits far outweigh the costs. Yeah, thank you.
I'll now invite Minister Lawrence Wong. He's online.
Good afternoon, everyone. I think we are all very disappointed by the latest setback in the flare-up of cases that we have seen amongst KTV outlets. We have and we will continue to take firm action against the few errant operators who have abused the system and undertaken illegal activities. Perhaps it's useful to take a step back and recall how we had this group of pivoted F&B operators. Remember, we had closed all such nightlife establishments since the circuit breaker last year. Subsequently, the Nightlife Association had appealed to the government to be given a lifeline. We offered them a grant for operators to exit the industry entirely. A few took up the grant, but many operators chose to pivot to other commercial operations. Some became cinemas, gyms, but quite a number took up F&B dining. So we have, following from that episode, about 400 nightlife establishments that are operating as F&B outlets today. Unfortunately, there are a few that have flouted the rules. As I said, we will take firm action against them. But as an additional precaution, we will also suspend all of the pivoted establishments for 2 weeks. During this 2-week period, we will test the staff and workers. We will inspect all of their safe management measures and protocols, and we will allow them to resume only after we are satisfied that the safe management measures are well in place. I think the onus is very much now on the Nightlife Association and its members to show us that they can get their act together and behave properly. Some have also asked why the hostesses were allowed to travel into Singapore. In fact, these ladies were in Singapore earlier, either on valid work permits, work passes, or visit passes sponsored by Singaporeans. For example, the Index case was sponsored by her boyfriend, a Singaporean, and at that time, Vietnam was a low-risk country. We had unilateral opening for Vietnam travelers. So she came in, sponsored by her boyfriend, on a visit pass. In fact, these visit passes are typically for family reasons. And the arrivals were tested. It's clear they didn't bring in the virus, as DMS mentioned just now. And so they caught the virus while in Singapore. How and exactly what happened, it's probably through one of the cryptic cases that still has been circulating within the community, but they caught it in Singapore, and that's how it spread through the rest of the KTV operations. The problem that arises is that these pass holders, seemingly on valid passes, work passes or social visit passes, have breached the rules by moonlighting as hostesses. So we will take enforcement action against them and also against any local sponsors of these passes who may not have given accurate information to ICA in their applications. We will also step up testing and tracing operations as best as we can to try and contain the transmission in the community. And you heard just now from Minister Ong Ye Kung how we are setting up multiple rings of testing, and we will be sending out SMS alerts for different groups of people. Some will have to be tested on a mandatory basis. Some will be issued an advisory and asked to monitor their health, and then you buy a self-test kit and test yourself regularly. Besides our extensive testing and tracing operations, we will have to make some adjustments to our wider community measures. And these moves will apply from 19th of July to 8th of August for 3 weeks. Why are we doing this? Because there is a real risk that the cases from these clusters would have spread to the community, especially if there are individuals who have not come forward for testing, and we suspect there are such individuals, and they would have spread the virus to the people around them. Potentially, this means that we can see very large clusters emerging over the coming weeks. In the past, under such a circumstance, we probably would have put in place very stringent tightening and tried to contain as much as possible the clusters from breaking out with very stringent tightening of measures, almost like a circuit breaker. But the difference today is that we have a much higher vaccination rate, and therefore we do not at this moment think there is a need for such significant tightening. Instead, we will take a more targeted approach and adjust our measures based on vaccination status and also with an eye to the hospitalization and ICU capacity in our system. So the measures are as follows. For higher risk indoor mask-off settings like F&B dining and gyms, the group sizes will be dialed back to 2 persons. Effectively, we will be going back to the position we were in before 12th of July. But if the group consists of fully vaccinated persons, then we will allow the group size of 5 persons to continue, because fully vaccinated persons are better protected against the infection and are less likely to infect others. For those who are not fully vaccinated and you want to join the group of 5, we will allow, if you have met a pre-entry test, you have been tested, you are negative, or you are someone who had been infected before and fully recovered, and therefore you have immunity. So that these will be considered as part of the fully vaccinated persons, and they will be part of the group of 5. This allowance for 5 people together who are fully vaccinated, this allowance will be only for establishments with mandatory safe entry systems in place, so that they can monitor and they can check the vaccination status of the customers. Of course, we appreciate that some families will want to dine together, and they have children who are below 12 years old and who are not eligible for vaccination. So we will allow unvaccinated children below the age of 12 to be part of the group of 5 if they are all from the same household. If the children are not from the same household, then they will be allowed to be part of the group of 5, but they will be subject to a cap. The cap is that they cannot be not more exceeding half of the group size. So that's the targeted approach we will take with regard to group sizes. For workplaces, very minimal change. Work from home remains the default, but we will not allow social gatherings. We had earlier, from 12th of July, allowed for social gatherings in the workplace, subject to prevailing rules in the community, but now we will remove that allowance, and therefore no more social gatherings in the workplace. For other settings, the measures remain unchanged. In particular, we will not change the rules and regulations around wedding receptions, because wedding receptions, many of the attendees would be subject to a pre-event test, so we will allow that to continue. And we also are mindful that this is a once-in-a-lifetime event for the wedding couple. We would like to minimize any disruptions to their plans. The measures that I have described will have an impact on some affected sectors. Earlier, I had announced an extension of the job support scheme of 10% from 12th to 25th of July. We will now extend this support to 8th of August for F&B businesses, gyms, fitness studios, performing arts organizations, and arts education centers. To provide more targeted support for eligible hawkers who are self-employed, we will extend the rental waivers and subsidies for fees for table cleaning and centralized dishwashing services by 1 month. Finally, I think the latest outbreak shows us how individual choices can so easily affect the wider community. I think it underscores the importance of individual and social responsibility in fighting this pandemic. I'm very heartened that aside from the few who have flouted the rules, the vast majority of people in Singapore have cooperated with the measures that we have put in place. And I have every confidence that working together, we will be able to recover from this setback and get back on track with our reopening plans. We will continue to monitor the situation very closely. As you heard just now from my fellow co-chairs, it is fluid. We have to watch very carefully, not just the infection numbers, but more importantly, our hospitalization and ICU capacity, and at the same time, continue to ramp up vaccination. So let us continue to work together and overcome this setback together. Thank you.
Thank you. Minister Wong will remain online to answer any questions from the media. Now I'll invite the media for questions.
Thank you, Minister and DMS. We will now begin with the Q&A segment. Members of the media, please remember to use the raise hand function on Zoom if you would like to ask a question, and a reminder to keep to one question only. If you are called upon, you will be prompted to unmute yourself. Please do so accordingly. May we have the first question from Straits Times? Timothy, please.
Thank you, Ministers, DMS. Now, illegal nightlife gatherings in Singapore during COVID are not new. We had such incidents at Golden Mile Complex last year, which should have made the authorities aware that regulations alone would not be sufficient to keep such incidents from occurring. Rather, better enforcement would be needed. And yet, shopkeepers near the latest cluster we spoke to told us that SDAs are only deployed in the area during the day. Why was there not more enforcement which could have prevented this? Thank you.
The enforcement agencies continue to work very hard across the whole of Singapore. It's not just in places like these. We know of illegal gatherings outside of KTV lounges. It has happened at homes. It has happened in hotels. It has happened in restaurants. It has happened even in warehouses. So I assure you, the enforcement agencies are stretched. They are working around the clock, pursuing every lead that they receive. But the illegal activities have not stopped. They continue. And we will continue to do our part as best as we can to go out with all the enforcement efforts. And each time we find someone, we will pursue and take very firm and tough enforcement action against anyone that breaches the rules.
Thank you, Minister. Can we have the next question from 早报, Zhipeng, please?
Hi, good afternoon, Ministers and DMS. This is Zhipeng from Zhaobao. The task force announced earlier this month that when at least half of the population has completed the full vaccination regimen around end July, there could be further easing of measures. So may we know that if we are still on track to achieve this in 2 weeks' time? Thank you.
That plan was announced before we have this big cluster. So for the time being, we will have to monitor the situation. And that plan, obviously now, we cannot just dogmatically implement it. In fact, we have to watch infection numbers, take up of our hospital beds and ICU to decide what is our next step.
Maybe I should just add that if you recall, when we announced the earlier plan a few weeks ago, we did highlight that the fact that we will have to do our best to ensure that there are no big clusters occurring so that we can continue with our program of reopening. But should there be any major clusters like what we are seeing today, then we may need to adjust our plan and our timing. And vaccination will remain a very key objective. If we are able to raise the vaccination rate much higher, then we hope that we will be able to reduce the number of infected cases and the number of serious cases and the number of cases that require ICU treatment. And if that is successful, then we will be able to then go back to our plan to reopen progressively.
So make no mistake, no. Thank you, Mingan, for adding to that. Make no mistake, as we vaccinate more and achieve higher vaccination rate, we will be able, there will be more certainty to transit to a new normal based on our plan. Except now we are at 43%. So I think the fluctuation and the uncertainty is still there. As we go up to 2/3, 70%, 75%, then the fluctuation and uncertainty will become less. Because we are more protected, we are more likely to be able to follow through with our plan. But we are not at that stage yet.
Thank you, Minister. Can we have the next question from CNA Digital? Jolela, please.
Thank you. I want to check, of the 400 pivoted establishments, how many took grants to do so? And will the authorities be seeking to claw back any grants given to those believed to have been involved in illegal activity?
Thank you. I don't have the detailed figures with me, but from my understanding, because we are still compiling the data, very, very few took any grants at all to pivot. And again, from what we have seen so far, the ones that we know that did take grants are not amongst the ones who have breached the rules. That's from the preliminary data that we have. Because you do not need to take a grant to pivot, right? Anyone that is in business can apply for an F&B license, you can apply to start up a gym, you can go and start a cinema. So many had, in fact, already gone on, proceeded to pivot on their own accord earlier, even without taking government grants.
Maybe I can add on. From our data, about 200 entities have received some support for them either to exit the business, that means they have to do something else and they will not be able to come back to the same business. And about 18 or so received a grant specifically to pivot to F&B instead of a nightlife operation. And for those who have pivoted, none of them are in the list of institutions that we have discovered to have violated the rules so far. So investigation is still ongoing, but none of those that have been picked up for violation have received any of the grants.
Thank you, Minister. Can we have the next question from Kang Wei, MediaCorp Channel 8 News, please?
Hi, good afternoon, ministers and DMS. We have heard a number of places closed yesterday, from driving centres, childcare to condominiums, and this has gotten, many members of the public worried. Could the ministry share more information, for example, with regards to the Comfort Delgro driving centre? Is it an instructor that's a confirmed case, and are all of they linked to the KTV cluster? And are we looking to make this information public? And would appreciate if you could answer this in Mandarin as well. Thank you.
Thank you very much for that question. The Comfort Delgro Driving Centre had cases there, but it's not related to the KTV cluster that we're talking about. In fact, the link is with a different cluster. This is associated with the household cases that had arisen excuse me, in the housing board flat, housing board block at Roswell Road, of which 2 of the cases had attended lessons at the Comfort Delgro Driving Centre at Ubi. Since then, we've seen several other cases emerge, including staff within the driving centre, and this includes a driving instructor and other staff, as well as I think someone who works in the canteen in the driving centre as well. So because of the emergence of some other cases, we cannot exclude the possibility that spread has taken place within the centre, and on an abundance of caution, we've closed the centre for disinfection and as well as to disrupt any potential additional transmission that might take place within the center setting. And this will take place for the required period under the Infectious Diseases Act. I think the period of closure is up to 14 days. In the meantime, all cases that have been detected are isolated, and contact tracing has taken place to identify the close contacts associated with these cases. And they continue to be under observation while they are under quarantine, with further testing to be done. So it's not related to the KTV cluster.
Just maybe a couple of points, if I read the question accurately, is that today when we do contact tracing, the rings that we draw is huge, much bigger than in the past. And that is because it's enabled by safe entry and trace together. So when we detect a case, whether it's Rowell Road or whether it's a driving center, using those data, we are able to identify close contacts, and they will be informed through SMS, either quarantine or watch your health, or through a health warning, health alert warning, or health warning, health warning or health alert. And so the rings are quite big. And secondly, too, each of us can also do our part by getting ourselves vaccinated. So I think these two are the more important focus now. Yeah, I know we no longer report all the details in our daily reports, but if you are in close contact with any of the confirmed cases, you will be notified. And at the same time, you yourself can also do your part, get yourself vaccinated. These two layers of protection is far more important, and so focus on those.
Thank you, Minister and DMS. Can we have the next question from Yahoo? Nicholas, please.
Good afternoon. So with regard to nightlife gatherings that breach safe management measures, so Minister Lawrence mentioned that the enforcement agencies are stretched. So what are the measures being taken to address this? For example, will more enforcement officers be hired? Are the agencies getting the resources that they need to ensure that the inspection regime is robust?
Well, Nicholas, the enforcement agencies will be beefed up. I mean, they are beefed up partly through safe distancing ambassadors already. So that's the first line of detection. Safe distancing ambassadors do not enforce, but they are there as a first line to detect, to encourage, to alert. And then the enforcement agencies that can come in. But you can appreciate that each time you do an enforcement check, there is a little bit of cat and mouse going on, because the enforcement officers come in, the people who are breaking the rules will be on the lookout. They see someone coming in, and then they may start to adjust and respond accordingly. So mounting an operations to catch and to pick up someone who has broken the rules is not always such a simple matter. You sometimes have to go in with a sting operations. You sometimes have to go in with a mystery shopper, with a plain clothes, and then you mount a special operations, especially when you have some information that wrongdoing or illegal activities are happening. And like I said, these operations have been mounted across multiple venues over the past year and a half. We will continue to step up. We will continue to support our enforcement agencies as much as we can. But at the same time, I must appeal to everyone in Singapore. Please do your part. The more we behave badly and break the rules, it will be a never-ending spiral, right? I mean, enforcement agencies have to keep on doing more, and then more bad behavior, and we keep on doing more, and then it never stops. And the consequence of every single action is so can be so consequential now, as we have seen. One single irresponsible behavior can have devastating impact for the entire community. So yes, we will beef up our enforcement efforts. We will ramp up as we have been doing. It's never stopped. It's never slowed down. It will continue. But we appeal to everyone, please do your part. And if you know of others who are breaking the rules, let us know. And we will collectively, let us remind each other to be responsible individually and as a society.
Thank you, Minister. Can we have the next question from SCNP? Dewey, please.
Ministers, I've got a question on the roadmap. So the task force has said that it's working on a roadmap to treat the virus as endemic. So, how much of a setback is this cluster to the roadmap? And also, given how these developments could actually increase fatigue among the population, are we worried that this could in turn drive this kind of drive more of this kind of underground activities?
Can't quite hear what you say. Maybe you speak slow because there's a bit of echo in your microphone. Maybe you speak slowly.
Sorry, yeah. So my first question is on the endemic roadmap. The task force has said that we are working on a roadmap towards treating the virus as endemic. So how much of a setback is this recent cluster to the roadmap? And the second question is on the recent developments driving fatigue among the population. Are we worried that this could in turn drive more underground illegal activities? Thank you.
Okay. I can try. Yeah. I would say the roadmap, if it's an expressway, we're still driving along the same expressway in the same direction, but the speed and the twists and turns is slightly different. You may have taken a bit of detour, go off the slip road before we can come back in. So I would describe the setback as like that, rather than saying that we're now taking a turn and going in a different direction. We are still on the same road, on the same roadmap. And the key to that, realizing that roadmap, remains vaccination. The higher the vaccination rate, the more we can keep to the road. Right now it's 43%. We are still susceptible to sometimes slipping off to a side road and coming back. But once we reach 2/3, 70, 75%, we are much more able to stick to the road that we are on. So I would say we are still very determined to go onto the roadmap and transit to an endemic situation. As for fatigue, you are right. I think everyone is fatigued. It's been, I even lost the count of number of months, 16 months, 18 months. Seems like forever. So I don't think I will associate fatigue with breaking of the rules. I think breaking of rules is just being irresponsible. Fatigue is really just mentally tired because you've been cooperating, we've been working very hard together. And that describes the great majority of us. We're all doing our part. And it doesn't mean that fatigue means you break the rules. Some of us fatigue, but we still continue. But we know that something's got to change. We all need to do some things differently, in which case it's vaccination, persuading our friends, relatives who are not vaccinated to get themselves vaccinated, channeling our energy somewhere else so that we can overcome the fatigue and get onto our roadmap and progressing according to the direction we set for ourselves.
Let me just add that if you take a look at the way we responded during this particular outbreak, it also gives a very clear indication the direction we are going. Under the previous circumstances, if this happened last year, we probably will go into a lockdown, if not at least phase 2 heightened alert. With current situation with a rapidly rising number of cases in this particular KTV cluster. But today we have decided that that would not be the best solution. We are looking at how we can be more targeted in some of the measures that we are going to implement to respond to such outbreaks from time to time. I will not rule out the need to roll back further if the situation worsens, as Minister Ong explained just now, depending on the situation and the threat it may pose on our healthcare system. Beyond that, we are adopting a more targeted approach in dealing with outbreaks like this. So we are progressing along the expressway, as Mr. Ong example that he used, and the light at the end of the expressway is quite clear, and therefore we continue to progress along this way. Sometimes we may need to pause for a while, slow down the pace, take into account the reality on the current situation, make adjustments to our speed and our direction, but I think we are clearly heading towards the other end of the expressway. So I want to also take this opportunity to again thank Singaporeans who have cooperated with us and have complied with the rules. Let us hang in there for a while longer. The key is really, I'm sounding like a broken record, the key is really to raise the vaccination rate. Once we have raised the vaccination rate beyond 2/3 to 70, 75 and 80%, I think that will allow us to do a lot more in opening our community and our economy without the threat on our healthcare system. Because vaccination will clearly help reduce the risk of severe outcomes.
Thank you, Minister. Can we have the next question from Mothership? Guan Zhen, please.
Hi, can you hear me? Hi, this is Guan Zhen from Mothership. I'd like to ask, in the case where there are families who have members like young children who are unable to be vaccinated, or like a group of like 571 friends, for example, how would these new rules apply to them?
So as I mentioned just now, the family with children, and if the children are below 12, therefore not eligible for vaccination, they can be part of the group of 5. There's no issue at all. But if there are 5 young children below 12 years old wants to go out and dine together, then, as I said, if they are all from different households, then there will be a cap. And as I mentioned, they cannot exceed more than half of the group size. So in a group of 5, 2 children, but then you need 3 vaccinated persons. So we have set out some of the detailed scenarios in order to make it quite, to let people know how the rules would apply. But the basic sort of message is this: for families with children in the same household living together, children below 12, not vaccinated, but you want to bring them out for a meal, it's okay. You can go out together as a family in a group of 5 persons, provided the parents are vaccinated, of course.
Thank you, Minister. Can we have the next question from Reuters? Chen Lin, please.
Good afternoon, ministers. What comment does Singapore have on WHO asking China to be more transparent on the origins of the COVID-19 pandemic? Does Singapore think more investigations needs to be done on the origins of the COVID-19 in China? Thank you.
I wouldn't talk about government policy, but I'll tell you that at this point in time, we're quite focused on the here and now, on the business of making sure that our society, our community is protected, and we are committed to carrying out the necessary public health actions to deal with the infections that we see in our community. It's always of academic interest to know where COVID-19 infection originated, but that's not the most pressing thing we have at this point in time. And we are quite committed to creating the right circumstance for us then to be able to regain the initiative in our path towards attaining an endemic phase in Singapore. So we note that there are various discussions and deliberations about understanding better the etiology of the infection. But at this point in time, what is most relevant to us is deciding what to do with our society, how do we deal with the community infections we have, and how we move on.
Thank you, DMS. Can we have the next question from Ximin? Jolene, please.
Hi, good afternoon, ministers and DMS. Okay, my question is, may I ask if we could have a breakdown of the number of patients and hostesses being infected so far? And of all the Singaporeans infected, are they all patrons?
Well, the epidemiological investigations are still continuing, and we will not be able to give you all the details in relation to each individual within the cluster, because interviews are still going on, and there are sometimes challenges reaching out to some of these individuals. Some of them may be a little bit less reluctant to volunteer information. So some of the information we have right now is putting the various items of information together and then forming some conclusions. But we're working with the other authorities to better understand the roles that each of these individuals had in these settings, so as to better understand what the modes of transmission are. Our primary concern within the Ministry of Health is really the public health angle, to make sure that we are able to identify as many of these cases as possible and to provide them with the relevant treatment and follow-up measures in order to take care of their welfare, but also at the same time to remove that threat to the community in terms of further onward spread for infection. We do know, as I had mentioned earlier, that a number of these individuals had spent a lot of time in KTV clubs and outlets. There may be a variety of different reasons why they do so, but we've noticed at least two different patterns. The first of which was people going to these outlets almost every day, whether it's for a meal, for other activities, but we've noted the pattern, they're going there every day. And for a number of these individuals, even in these different days, they're going to multiple KTV outlets. And so our strong suspicion is that mass-off activities have occurred in these contexts, and transmission has taken place, irrespective of whether they were hostesses, whether they were patrons, whether they were visitors to these outlets, or whether they were just working in some of these outlets as well. So our public actions carry on, irrespective of what specific role these individuals have taken.
Maybe I just add, the answer to that question might be in my statement just now as well. I don't have the detailed numbers that you need, but first there are the quarantine numbers. So these are people who have visited the outlets, which we can immediately identify. And then there are the staff and patrons that we managed to get through safe entry and TT tokens. And then thirdly are patrons that we don't know about, and we urge them to come forward to get tested. So I think these three groups are contributing mainly to the infection numbers now. But so for the quarantine group, we do expect as the quarantine days go by, you may see more cases coming out from there. For the staff and patrons, I reported just now, we test over 3 days, and yesterday in fact was 0 already. So maybe that reservoir is drying up. So I think that those are the contribution to the numbers, infection numbers now. But as DMS say, we also will begin to see unlinked cases, people not feeling well, coming forth, get themselves tested and positive. And epidemiological investigation will have to be carried out before we can link them to the cluster, and whether it's a KTV cluster or it's a driving center cluster. And those are likely to be secondary transmission, second, third, fourth generation transmission from the earlier group. So I think this is the pattern of how the cluster is evolving.
Thank you, Minister and DMS. We will now take the last question. Can we have today? Pei Ting, please.
Hi, Ministers and DMS. May I clarify if over the over 200,000 people who are quarantined at home, or are they quarantined in designated facilities? And if they are self-quarantined, are these quarantine orders or are they self-isolation? Thank you.
It's a mix of different settings. There's no change to our protocol for quarantine operations. So those who are able to, we will bring them into our quarantine facilities and we will isolate them. There are certain settings where we may make exemptions and allow a more targeted home quarantine arrangement to be provided. And this is often because there are also caregivers for these people under quarantine, are also caregivers for young children, and it may not be easy or practical to nurse these individuals within the quarantine facilities that we have. Sometimes they may also have chronic medical conditions for which a higher intensity of caregiving is actually required. But in these settings, whenever a home quarantine order is issued, the requirement for isolation and to stay away from other people is as robust as what is carried out in the government designated quarantine facilities. It's backed by a formal order And if there's any breach in this order, people are going out when they're not supposed to go out, it is enforceable, and an individual can be prosecuted. So it's just basically a quarantine order. The difference is in the setting, whether it's done in a government designated facility or whether it's done at home. We do assess at the beginning whether or not the home setting is suitable for home quarantine to take place, and that includes determining who else is in the family, whether the accommodation setting is suitable for that individual to isolate individually on his own. So it's not the case that any individual simply requests and it will be approved automatically on the basis of a request. There is an assessment to determine whether it is suitable for home quarantine to take place. In both settings, testing will be done, and that includes testing on entry into a quarantine phase and exiting a quarantine phase, as well as any additional testing we deem necessary in between.